Catharsis. What is it? Catharsis means release of an emotional stress or tension just to get it off your chest. People tend to share their stress with someone in order to feel better. For example, someone is having a very bad week in school which creates a lot of stress. Talking out this stress with a friend or teacher may help to reduce the stress and makes a person feel a lot better. This stress can also be released through some physical activity. Self-clarification. What is it? People tend to talk to others about their beliefs, opinions, and thoughts on certain things, attitudes, and feelings to help clarify the problems. In simple words, it just means talking out the problem with someone to get the clarification and understand oneself better. For example, a person wants to choose a career and talks to a friend of what he or she should pick. A friend knows what the person is good at and help identify the career that best suits for the person. Self-validation. What is it? Sometimes we are concerned if the information we disclose will be accepted by the listener or not. This means that we are validating our behavior confirmation of the belief on the information that was disclosed. This type of self-disclosure seeks the confirmation of the most important parts of self-concept person has.
So, in keeping with our self disclosure and relationships topic, this also includes relationship maintenance and enhancement, as well as social control, which are the two that we will cover now. Relationship maintenance and enhancement. So, there is a huge body of research that has strongly proven a correlation between the quality and the quantity of self disclosure within marital satisfaction. However, this does apply to all other personal relationships. So, the more you share in genuine and honest and real conversation, the stronger the bond between the two individuals in the relationship, whichever kind of relationship that may be, tends to be. So, a good example of this in the healthcare field is during a patient pregnancy. Now, imagine sort of a teen pregnancy situation when a doctor is honest about their relationship with their spouse, thus encouraging the patient to be honest about her personal experiences within her relationship. And the patient will feel that she can identify with the doctor and she is more inclined to share her struggles with them. And this opens the door for the doctor to recommend professional help. And we see that especially within the teenage pregnancies that is rising all over North America. Social control is slightly different. It basically means that when one individual reveals an important piece of personal information that is of significant worth or value to the other person in the relationship, it may result in an increase of control in the present situation in which the two participants of the relationship are in. So it's kind of confusing, but a good example of this is going back to our teen pregnancy example. If the patient reveals to the doctor that she will, like, absolutely will not have an abortion due to perhaps religious beliefs, then it gives the patient a certain amount of control in that particular situation. Control in the sense that now the doctor knows that she will not, cannot, absolutely will not do the abortion. So now alternative methods such as adoption can be recommended by the doctor. However, the patient still holds that amount of control because she has disclosed that particular type of information.
Another part to self-disclosure is manipulation. The motives for disclosing vary from one situation to another. When it is a friend, a reason people give for disclosing is because they want to maintain their relationship and enhance it. Disclosing to friends is something that we often do to strengthen our relationships, and this usually occurs in the context of positive relationships. The second important reason is self-clarification. Self-clarification is to sort out confusion to understand ourselves better. With strangers, reciprocity becomes the most common reason for disclosure. We offer more about ourselves to strangers to learn more about them. We often do this so we can decide whether or not to continue the relationship. An example where people do not tell a lot about themselves is in the healthcare environment, and this can be when healthcare workers need to get patients to disclose a great deal of information very early on in the relationship, and this can be a huge challenge for the healthcare worker. Impression formation is when we reveal information about ourselves to look good. This information is usually positive. An example of when this can happen is when people have a personal trainer at the gym and The personal trainer asks them about what they ate this week, and they tell them all the healthy foods they ate, such as broccoli, or they had salmon, and they leave out all the unhealthy foods that they ate, such as brownies or chips, just so that they can look better in the personal trainer's eyes.